Hello everybody and welcome to the last lecture for the Introduction to Forensic Science at Midwestern University for the winter quarter 2017-2018. So in this lecture, which is only half an hour long, we will be discussing a little bit the role of the healthcare provider in providing both prevention and also treatment for substance use disorders. This is once again an online lecture. It will be relatively brief, only half an hour, and it should have been posted by February 13th. I apologize for the late post on February 15th. Ahead of the final exam. As I mentioned in class, what we cover here is only for informative purposes. It will not be part of the final exam. So it's really only like a little bit of the icing on top of the forensic science cake, so to say. So when we talk about drug abuse or substance use disorders, it is often a multifactorial approach. So obviously the best approach is the prevention of illicit drug use or even somebody developing a substance use disorder, no matter if it's an illicit or illicit drug. But the second best is obviously to treat somebody who is a user of illicit drugs or developed a substance use disorder. And there, the identification of best practices is still something that we are kind of battling with to some degree, because it often is a multifactorial approach, and depending on our healthcare system that we have, depending on a national framework for it, it differs from nation to nation. So especially the training and the skills development for frontline workers is important here. So social workers often have to have specific resources at their disposal, and that is sometimes lacking. So we have particular risk groups that are at a higher risk of becoming dependent on a drug of potential abuse. Obviously, the monitoring and evaluation of drug abuse, including data collection and analysis, is important, and further research, furthering the research to understand better what is going on in terms of molecular mechanisms of drug abuse, what actually triggers somebody to be more likely to develop a substance use disorder versus somebody else, what maintains this substance use disorder, and what can we do to prevent or treat a substance use disorder. So when we talk about, and we had this discussion throughout the semester already, throughout the quarter, treatment of users of illicit drugs is something that we are kind of battling with, because on one side there is a desire to, or a kind of ingrained in the law, a kind of desire to incarcerate, to punish somebody who is using a drug that they should not be using by law, especially if it's a scheduled drug. So there is kind of this punishment approach. But on the other side, somebody who has developed a substance use disorder should also be offered treatment at the same time. So often treatment is a multifactorial approach where you have to use medication and a therapeutic intervention, behavioral approaches to change behaviors that maintain that substance use disorder, that maintain and ingrain a certain pattern of behaviors that maintain the drug-seeking behavior. And so especially medication that removes the physiological and the somatic drug-seeking behavior, kind of the cravings, and the behavioral treatment approach has shown a higher effectiveness if the social environment is integrated. So if somebody is actually not incarcerated and removed from their social environment, that has shown a higher treatment success than being incarcerated. Concomitant incarceration usually leads to a higher rate of relapse, and there have been models in other nations that have shown higher rates of success. So in conjunction with that, providing resources to the community can provide better outlook for treatment success. So clean needles obviously is a big thing to reduce the risk of infection. Hepatitis C, hepatitis B, HIV, other concomitant infections that can be spread if needles are being shared by those who are injecting drugs. Needle disposal prevents needle sharing, that goes hand in hand. Social integrative programs help with job seeking, stable community support. These are all interventions that have been tried and have been shown to provide benefits, especially when it comes to infection that reduces healthcare costs. And most of these interventions have really shown to be effective. So when we look at what kind of treatments are available for the various drugs of misuse and abuse, we are at different stages, so to say. So our fundamental knowledge in terms of the science, our evidence of effective treatment, and then widespread availability of that treatment. When we look at alcohol, we have a fundamental knowledge of alcohol addiction, widespread epidemiological knowledge, widespread knowledge of what it does on the molecular level. And we have evidence of effective treatment, both medical treatment, pharmacotherapeutic treatment, as well as behavioral interventions. The widespread availability of treatment is somewhat questionable because some people may not seek it. Often the drugs are prescription drugs only. So if somebody doesn't have health care that covers such drugs, they might not be available to them. Tobacco is one of the few drugs where we have fundamental knowledge. We know nicotine is primarily the one. We have evidence of effective treatment, and it's widely available. When it comes to cannabis, we have a fundamental understanding. We know that they bind to cannabis receptors, the cannabinoids, THC and others. We don't really have evidence of effective treatment to date, and so we don't have any widespread availability of that treatment because we don't have effective treatment. Heroin and other opioids, fundamental knowledge, we know what they do. We have evidence of effective treatment. We have various opioid receptor antagonists and other drugs, methadone obviously for maintenance, buprenorphine. But once again, widespread availability of that treatment is not necessarily given depending on where the person is located and what their healthcare coverage status is. Psychostimulants, including cocaine and amphetamines, we have a very good understanding in terms of fundamental knowledge. There are some experimental treatments, but none is really effective yet in terms of withdrawal, mitigation of withdrawal symptoms and the like. So therefore we don't have a widespread availability of treatment because they're all experimental, they're not well established. And for inhalants, we don't really even know what they do on the molecular level yet, or on the cellular level. We know that they probably act similar to many of the general anesthetics, but it's not very well established. So that's where we stand for the most part, for many of the illicit drugs. So we have yet a long way to go in terms of research that facilitates treatment. When we talk of prevention of illicit drug use in schools, that is kind of where we want to start, or where we often see the starting point, because Monitoring the Future, for example, as a survey, it has been shown to have a tremendous forecasting impact on what 8th, 10th, and 12th graders will do later on in life potentially. Obviously, we see a significant decrease in terms of how these 8th, 10th, and 12th graders will later on use drugs. Many of them are just curious and then will not go on to become drug-dependent users later on. So obviously, one is to limit the access to illicit drugs, especially for children and adolescents. A consistent and constant education. That education needs to include, though, not only making them curious about drugs, but also making them aware of the harms that these drugs can cause in the long run. Drug-resistant skills as part of the school curricular activities. Pro-social and integrative bonding to the school and community, that can be quite effective. Extracurricular activities often have shown to be quite effective. Monitor and frequently evaluate core activities for prevention and intervention in schools. They are trying to bring back certain programs like DARE, for example, which has not been shown to be as effective. What has been shown to be a little bit more effective are more peer watch programs that establish more of a peer network rather than kind of trying to scare children into, or adolescents into, not using drugs. So when we look in a more social setting outside of school on a larger scale, there are certain things that can be done. Obviously, look at the family setting, socioeconomic evaluation based on behavior, monitor parents that display signs of child neglect or abuse. Often child abuse is linked to a higher incident of drug use. Community involvement or isolation, so integration into social activities outside of school often has shown a positive impact, so that drug use is less likely. It is very important to reintegrate parents who have been drug abusers. That benefits children to a large degree, so instead of shutting them out, shunning them, to really reintegrate them, not only for the benefit of the parents, but also specifically of the benefit of those children. And foster understanding and provide supportive environment to reduce relapse. That is important in regards to really provide a caring environment, because relapse often is fostered or is more so, it's more prevalent if there is no substitute for an emotional support system. When we talk about evaluation of illicit drug use, or how likely somebody is when it comes to a medical setting, there is what's called the modified assist approach for evaluating potential drug abuse or misuse, the so-called 5 A's of intervention. Ask is the first A, introduction and offer support. Ask about lifetime drug use. Identify patient's risk level by screening for current drug use, abuse, or misuse, including alcohol and tobacco consumption. Sometimes patients may not be aware that they are at risk or that they are already misusing a drug. They think that their use is tolerable, acceptable, or completely normal. And at times it may still be normal, but it may be going in a direction where certain daily activities may be dependent on them using a drug. Advise, review the screening results and risk level, high, moderate, low risk for developing substance use disorder. Provide medical advice and point to potential health risks. So when it comes to tobacco use, alcohol use, if certain daily activities cannot be performed or are harder to perform in the absence of a drug, then there might be a risk for dependence. Obviously, there are certain distinctions that need to be made. If somebody has an anxiety disorder or a depressive disorder and they cannot perform certain tasks without that drug, then there's a therapeutic indication that usually goes then hand in hand with a therapeutic intervention, or it should be with a therapeutic intervention. Assess where is the patient's readiness to quit, support, changes, small steps. So if there is a prescription and that the drug has been legally prescribed and they take it as intended without wanting to change the dose by themselves, adjust the dose or anything like that, then there is no indication for you to make a change, but make them aware that taking medication over a longer period of time may not prove to be the solution to the underlying problem. So that's an important note to make. Medication benefits certain disorders in the long run, certainly. There's no question about it. For certain mental disorders, that is also the case. It always is a little bit questionable to what degree it benefits, for example, anxiety and depressive disorders. There are certain depressive disorders that need to be treated for life because there is just a chemical imbalance that cannot be remedied with therapy interventions. But make the patient aware that if they find a way to reduce at least the medication and to get to a different state of mind, then it might benefit them in the long run. But when we talk, for example, tobacco or alcohol, there are certain ways to reduce consumption and phase that out. Assist, a progress report, referral to other professionals, prescription medication that aids in reduction and eventual withdrawal. So that would be classical for alcohol, tobacco, and obviously something like prescription opioids, where definitely an intervention is advised. And there are obviously particular addiction professionals, healthcare professionals that one can turn to. Arrange continued monitoring and report, set small goals, so don't do the quit cold turkey that is usually not advised. Coordinate with other providers and family and friends, especially having that social support system is very important. So when we look at the Office of National Drug Control Policy, this is a little bit of an older report, but if we just look at the number of deaths, and this is up until 2007, so the opioid and heroin deaths have definitely gone up since then. You see that the trends are not looking good. They're not looking in favor of an improvement of the situation. And the opioid epidemic has certainly contributed to many issues. Actually now, if you look at drug-induced deaths, this is the overall death rate related to drugs. So not only illicit drugs, but to all drugs. But just the drug deaths related to heroin and opioid overdoses just surpassed in 2016 or 2017 that of fatal motor vehicle accidents. In 2000, I think it was 2016, might be wrong, but that gives you an indication of where we stand at the moment on this issue, and that's why it's so important that we need to change policies. So the training of healthcare professionals in approaching substance use disorders with their patients, especially when it comes to opioid drugs and the benzodiazepines, is quite important. We tend to forget a little bit or cast to the side at the moment because it's so much in the public eye, opioid epidemic and opioids, that we tend to forget all of the other drugs that are out there. Methamphetamine has recently seen an uptick again. The New York Times reported about that about 3 or 4 days ago. But benzos are being widely misused and abused. We shouldn't forget about some of these other drugs that are being used and abused. There is obviously a responsibility that you have as a healthcare provider to closely and carefully monitor chronic conditions that require treatment with medications that have the potential for misuse. And just because somebody's taking an opioid doesn't mean that they are automatically prone or automatically at risk of abusing it or misusing it. There is somebody really needs to take a larger amount in order to get into that misuse and abuse bracket. It's always advised to obviously make the patient aware of it, but don't try to scare somebody away from opioids, because it is important. Opioids are still very important medications for pain control. So what remains important here is to train adequately healthcare providers and healthcare professionals rising on the issues of drug misuse and abuse. So stimulants are associated with significant increase in stroke and heart attack risk, and opioid dependence may lead to the respiratory depression, which we all know that affects and also social interaction and ability to operate vehicles and job performance. The same applies to many of the other CNS depressants. And here are a few important websites. So the DARE initiative, I'm still pointing it out because it comes back. The Attorney General, Jeff Sessions, has pointed out that DARE is something that he would like to see come back. NIDA is an important organization within the National Institute of Health. It's the National Institute of Drug Abuse, which provides many resources. The Partnership for Drug-Free America has also many resources for teachers, caretakers, so for the general public. Obviously, the CDC has resources as well, statistics. And then there are often workshops that are offered by local state health departments and school districts that also offer that on a regular basis, actually. So when it comes to community-based prevention programs, education is really a crucial first step in tackling the problem of prescription drug abuse, diversion. So here it's important that parents, grandparents are aware that medications are safely put away out of the reach of children and adolescents' hand, and that they keep track of it and that they don't keep any medication that is expired in the house or unsecured. And implement prescription drug monitoring programs and enhance those programs to make sure they can share data across states. That has not been fully implemented yet. I'm not exactly sure why that is the case, but it has not been fully implemented yet. The take-back prescription days have been increased over recent years. It started, I think, in 2008 or 2009. I think 2009. So that is kind of going on. There could be done more. I think there should be ongoing locations that should be really dedicated locations that take back prescription drugs and expired ones, or those that people simply do not need. If somebody has been prescribed too many drugs, too high of an amount of a particular drug, and they simply don't need it, then they should be able to get rid of that rather quickly instead of keeping it around. And obviously enforcement with the tools that really target those who are distributing. So prescribing practices need to be improved. That goes to healthcare providers and doctor shoppers or drug-seeking behaviors. Especially doctor shoppers is something that needs to be addressed. The monitoring and evaluation of drug abuse, I talked about monitoring the future. So that is a project out of Michigan State University that has been going on since 1975. Very nice projection of potential future trends because they monitor 8th, 10th, and 12th graders. The drug abuse monitoring program by the National Institute of Justice, Arrestee Drug Abuse Monitoring, the ADAM program, looks particularly at those who are incarcerated. Substance Abuse and Mental Health Services Administration looks at population data and relates that to overall mental health, and then obviously the Drug Enforcement Administration, the DEA. There are several interventional longitudinal studies that we look at over a longer period of time, investigating the potential for drug abuse, misuse, as well as potential treatment and therapeutic options, and a number of professional journals that are very well ranked. They have high impact factors, and you can see here that there are a number of these journals that have received very good that are very widely distributed. So, some recent and interesting topics related to drug abuse, health issues, and treatment options. The relationship between meth abuse and the development of Parkinson's disease. It has been shown that high and frequent meth abuse and the incidence of Parkinson's disease seem to be correlated. So those who have been using meth over a longer period of time and in high amounts are more likely to develop Parkinson's disease, which is not too surprising because meth acts on dopamine receptors and therefore it is suspected that the neurotransmitter and the dopaminergic neurons are over time kind of worn out, so to say. Neurophysiological connections between inhibitory and excitatory neurotransmission in drug dependence. This is a complex issue that doesn't necessarily only involve one particular brain region. So when we talk about glutamate and GABA, we have the GABA shunt involved in that. And that is a very close correlation or a relationship because glutamate is metabolized to GABA and vice versa. So they can both kind of directly be converted into each other. And then GABA can be further metabolized through the citric acid cycle. And there's a lot of neurophysiology involved in that cycle. And it's not yet entirely clear how this homeostasis can be thrown off to make some people more prone to develop a drug dependence. Psychological and social factors that contribute to drug abuse and dependence, that is always an evolving topic as we get more data and shuffle it into that huge and ever-growing data set on social factors that can influence or that are contributing factors to drug abuse and dependence. It's kind of hard to really develop solid predictors of drug dependence and drug abuse. In the end, it really boils down to the individual, and maybe there's more to be found on the genetic level. Different pathways of drug tolerance development in relationship to ethnicity, age, and gender. That seems to be related. Gender, when we talk about gender, we often talk about sex hormones. And there seems to be an issue related to testosterone influencing certain expression of proteins, and that in turn can be related to a particular subset of receptors, dopamine, norepinephrine receptors, and potentially also influencing the production of these neurotransmitters. And that has been shown to have an impact on some drug tolerance development in males versus females. It's not yet clear. A lot more needs to be done in that area as well. Okay, I'm already over time. This is the final note. So I already said it in class, but I just wanted to thank you all for a great semester, and I really hope you enjoyed this elective course. And the wide field of forensic science offers many opportunities, and I hope some of what we discussed may apply to your responsibilities down the line as a pharmacist, and you found it interesting, even if it doesn't directly apply to you as a pharmacist later on. Keep in touch. For some of you, this will be the last time that we've worked together in a course. We've taken IS2, use and abuse of drugs, and now the Intro to Forensic Science. For those of you who haven't taken use and abuse of drugs and still want to take that, I look forward to seeing you again then. If you have any questions, feel free to reach out to me. I've got my Midwestern email address, which from time to time is being suspended because I'm an adjunct, so they just decide to throw me off, or my private email address at gmail.com. Some of you are already connected with me on Facebook. I've got a LinkedIn profile as well, and that is pretty much it. Okay, so for those who watch it before you take the final exam tomorrow, good luck on the final exam, or good success. Best wishes for a successful final exam. And yeah, obviously for your other finals that you have coming up. And enjoy the break between the semesters, between the quarters. And best wishes to all of you. And hope to see you around. Take care, everybody. Bye.